Good afternoon. Today we are going to study the bone. This is called as scapula. The scapula is the triangular bone which is situated on the pectoral girder on the posterior side. So this is the position of the scapula on the posterior side. It is also called as the shoulder blade. The type of this bone is the flat bone. As it is a triangle shaped bone, it will have three angles and two surfaces. The three angles is, this is superior angle, this is inferior angle, this is lateral angle. Two surfaces are on the anterior side, this is the costal surface, and on the posterior side, this is the dorsal surface. On the posterior side, the spine divides the posterior surface into two parts. This is the supraspinous fossa, infraspinous fossa. And the anterior surface is concave and it is having a fossa, that is the subscapular fossa. Now we will see the borders of the scapula. The superior border will extend from the lateral angle to the medial end, and the medial border will extend from the superior pole to the inferior angle, and lateral will extend from the lateral end to the inferior angle. Now there are three processes for the scapula. They are, this is the spinous process which divides the posterior surface into two parts. Then the lateral end of the spinous process is expanded and it forms the acromion process. And on the anterior side here you are seeing this is the coracoid process. The coracoid process gets its name, it is beak-like, so it is called as coracoid. The lateral angle of the scapula is articular with the head of the humerus and it forms the shoulder joint. Now the side determination of the scapula. On the scapular medial border is thin border and the lateral border is thick border. On the anterior surface there is a fossa and on the posterior surface there is the spine. And the lateral end or the lateral angle bears the glenoid cavity. So this bone is of the which side? This is of the left side. This is anterior surface. Now we will see the attachments of the scapula. On the anterior surface in the subscapular fossa there is the origin of the subscapularis muscle. Then the lateral end bears the glenoid cavity which will articulate with the head of the humerus like this here to form the shoulder joint. Just above the shoulder joint here again the lateral end of the clavicle will articulate with the acromion process and from acromioclavicular joint. Okay. Now again on the glenoid cavity there is a supraglenoid tubercle and infraglenoid tubercle. The supraglenoid tubercle gives origin to the long head of biceps brachii and the infraglenoid tubercle give origin to the long head of triceps brachii. On the coracobrachialis there is the origin of short head of biceps brachii and coracobrachialis muscle. We will see in diagram also. So this is the coracobrachialis origin, short head of biceps, this is long head of triceps, this is the subscapularis fossa, in that the subscapularis muscle is taking origin. On the medial border here there is insertion of the serratus anterior muscle, whole along the length of the medial border. Okay. Now we will see onto the posterior surface. On the posterior surface in the supraspinous fossa there is origin of the supraspinatus muscle. In infraspinous fossa there is origin of the infraspinatus muscle. The medial border is the thickest border of the scapula. Now on this medial border there is origin of teres major above and teres minor above and teres major below, and on the inferior angle there is origin of the latissimus dorsi here. So this is teres minor, teres major and latissimus dorsi taking origin on the lateral border of the posterior surface. Now here on the spine is having two borders. This is the inferior border and this is the superior border. On the superior border there is insertion of trapezius muscle, and the inferior border give origin, that is, to the deltoid muscle, like this. Okay. Now the medial border, they will have insertion of the levator scapulae muscle above, then rhomboides minor and rhomboides major below, like this. So levator scapulae, rhomboides minor, rhomboides major. Now on this superior border there is one ligament which will cover this notch. This is suprascapular notch. It is covered by the suprascapular ligament. Below that there is the suprascapular nerve, and above there is the suprascapular vessels. Now here, which is articulating, this is the coracoid process. Here there will be the ligaments. They are the coracoclavicular ligament, and there is insertion of pectoralis minor muscle. Here you can see in this diagram pectoralis minor and coracoclavicular ligaments, that is conoid and trapezius part, and below that there is the coracoacromial ligament. So these are the attachments of the scapula. Now the ossification of scapula. The scapula ossify in one primary and 7 secondary centers. The applied anatomy of the scapula is that the serratus anterior muscle, which is inserted on the medial border, when the nerve supplying to serratus anterior is paralyzed, then the medial border cannot stand along with the ribs. So there is winging of scapula. The condition is called as winging of scapula. Thank you.